everyone. So today I want to talk about some types of medications that lupus patients are usually on, and I have personally been on in my experience with them. I'm not a doctor. This is just for educational purposes, just to give you an idea of the kind of things that some people have to go through just so they can stay healthy, and the fact that if you're not on any medication, you're extremely lucky. So let's get into it, and I hope you learned something new and enjoy. So one of the main medications used to treat lupus belong to the category of anti-malarial drugs, also known as hydroxychloroquine or Plaquenil, chloroquine. And I'm sure you must have heard about the recent controversy surrounding these medicines and how they were thought of as possible treatment for COVID. That was not true. So these medications help control lupus by moderating the immune system without predisposing someone to infection. And they also help inhibit the overactive immune cells and keep them from degenerating out of control. Side effects for hydroxychloroquine are relatively rare, but it is said that the long-term use can cause damage to the retina, which is the light-sensitive portion of the inner eye. If deposits are found, it's usually suggested that one stops the medication for some time. Another type of medication that is extremely important for lupus patients is corticosteroids. This word gives me nightmares in the day.
Who are you? I'm your worst nightmare.
Yeah, every lupus patient knows that this is trouble. The word steroid, I know, often sounds frightening because of the media attention that it's been given and how it's been associated with athletes using it to put on muscle. Even when I tell people I'm on steroids, they do give me a strange look at first.
What?
But remember that steroids are actually a group of chemicals that make up a large portion of the hormones in our body, and they're used to treat lupus and are different from the ones that we hear about in the news. The function is basically to help slow and stop the process in the body that makes the molecules which cause an inflammatory response. These steroids also reduce the activity of the immune system by affecting the function of cells called white blood cells. In reducing inflammation and immune response, they actually help prevent damage to the tissues in the body. But when it comes to side effects, it has a really long list. So I won't be able to talk about all of them, but you can definitely check them out on the link that I've given. But one thing that I especially struggle with is how it changes your appearance. Once a patient starts taking steroids, it becomes quite evident because of the changes that they see in their appearance. Some of them include acne, development of round or moon-shaped face, weight gain, increased appetite. I used to feel so hungry all the time. Redistribution of fat leading to a swollen face and abdomen but thin arms and legs. Increased skin fragility, which causes easy bruising, and hair growth on the face. I have to admit, it is a roller coaster ride and it's not pretty. And I'd personally try my best to get off of them as soon as possible. So another type of medication that I have also been on for the last year or so are called immunosuppressants. So these were originally used in patients who received organ transplants so that it can help prevent their body from rejecting the transplanted organ. Because immunosuppressants reduce the immunity, people taking them are at an increased risk for infection. They're advised to stay away from people who have even a common cold or any other illness. Make sure that we wash our hands regularly, maintain good personal hygiene. Also, this COVID situation isn't really new for some of us. In terms of side effects, they're pretty safe according to what I was told, but maybe can sometimes cause an upset stomach, but I was lucky enough to adjust to them well. Thank you so much for watching and being so patient and sitting through the whole video. I hope you learned something new, and I'll see you soon. Bye.